She is an active clinician and board certified in psychiatry and internal medicine. She previously served as Chief Medical Officer for Magellan Prescription Management, where she led the development of patient-centered clinical programs, quality, and drug information. She also served as Chief Medical Officer for Regional Health Plans, where she gained experience in Medicaid, Medicare, exchange, and commercial populations. She is now the President and Chief Medical Officer of Magellan Health. Please welcome Dr. Carolyn Carney, MD.
I'll start with hello of my home state, Iowa, and my current state, Arizona. It's nice to be here. My name is Dr. Caroline Carney, and I am now the CEO of Magellan Health. Who would know that growing up in a town of 600 in Iowa, someone would be able to have the life I have had, and I'm going to share with you why that is. It's because I am the proud daughter of a Korean War veteran. I am the sister of 2 retired naval officers, and I am the aunt of a Marine naval officer. My niece is a naval officer, and another nephew who serves in the Air Force. We come from a long family of those who have given service, and I am incredibly proud to be here today to address you all. When someone asks me, what's the defining moment of your career, I don't think back to recent years. I think back to when I was 17 years old, and I was elected the governor of Iowa Girls State. That was more important to me than anything in my whole career. Why? Because I spent the next year, my 17th year, touring the state of Iowa and visiting posts all over the state and listening to stories, your stories, that fill my heart to this day. And I am so very thankful for that experience. I am delighted to see that Girls State and Boys State continue to thrive, and Girls Nation and Boys Nation continue to thrive. Thank you all for giving other kids that experience. Thank you for letting kids from small towns in rural Iowa know that they can be and achieve. Today, I'm here to speak about the work that Magellan Health and WellCare do. WellCare is our partner company, and WellCare works in concert with veterans across the country. Many years ago, when my parents aged into Medicare, my dad a veteran, it was a confusing process to navigate through all of the various opportunities. Even as a doctor, I was poorly equipped to guide and direct them. I wish that they had what WellCare now brings to the American Legion members. In August of 2023, WellCare proudly became the official Medicare Advantage partner of the American Legion. Our goal in the partnership was to connect Medicare-eligible veterans, their spouses, and the greater military community with innovative products and solutions that complement the benefits that you all receive through the Veterans Affairs Healthcare Organization. Together with the American Legion, WellCare is continuing to ensure that veterans across the country understand their healthcare options and have access to resources that truly do make a difference. We are also deeply committed to addressing one of the most pressing issues facing the veteran community: mental health issues and suicide. Through our partnership, we aim to reduce stigma, to raise awareness, and to provide meaningful support to prevent veteran suicide and to promote emotional well-being. WellCare is action-oriented. Our company has taken many steps forward in the last year. So far this year, we've conducted numerous virtual webinars that explain how Medicare Advantage benefits work with VA benefits. We have hosted hundreds of in-person events at local posts all over the country. We continue to educate members how to make the most of their Medicare Advantage plans. But our deeper mission is to foster meaningful connections, to combat social isolation, and to support mental well-being within your communities. We built a community relations team that has been working to build strong local relationships and to support impactful initiatives in your communities. A standout example is our collaboration with Post 172 in Mercedes, Texas, where we've actively participated in monthly meetings and family nights. Together, we've supported efforts such as donating hygiene items for deployed troops, distributing bottled water to flood-affected residents, and sponsoring the Post's second annual bike ride to raise funds for a facility dedicated to mental health needs of female veterans. Beyond local posts, our team has also attended over 20 department conferences to connect with post leaders and staff, to share best practices from across the country and explore new opportunities for collaboration. WellCare was honored to sponsor the American Legion Legacy Run in 2024 and again in 2025. This powerful tradition unites riders and communities in support of military families. Our sponsorship reflects deep respect for this mission. We provide custom ride bags at the start, refreshments at support stops along the route, and we host a celebratory finish that includes a commemorative challenge coin to honor the rider's dedication. And over the past year, we've deepened our engagement with the Legionnaire Insurance Trust, reinforcing our shared commitment to veteran well-being. Additionally, we've begun a meaningful collaboration with the American Legion Auxiliary, expanding our support to include the families and communities that stand behind our veterans. WellCare listened to your experiences and wisdom, helping us develop a deeper understanding of the critical importance of mental health in the veteran community. In doing so, we've enhanced our Medicare Advantage product to include expanded mental health benefits to ensure that you all have greater access to the care and support that you deserve. Mental health impacts are real, and they often start prior to employment and during deployment. Because of this, Magellan Health, the WellCare partner, goes to work every day on bases across the world to support those in active duty. Magellan partners with the Department of Defense to deliver free, confidential, face-to-face counseling through the Military Family Life Counseling Program. We bring over 1,400 counselors to bases on over 180 military installations, including 14 right here in Florida. We bring rapid response to crises, including Hurricanes Milton and Helene, the January 2025 tragic mid-air collision in Washington, D.C., and the recent CDC shootings, providing counseling, outreach, and resource navigation to those in crisis. Every month, Magellan Health delivers over 92,000 counseling sessions, 46,000 consultations to military leadership and child developmental and school staff on bases, over 56,000 outreach and engagement services, and over 83,000 referrals to behavioral health services and community resources. In doing this work, our MFLAC counselors specialize in applying evidence-based interventions that address the complex life situations of those who are in active duty. Does it work? Absolutely it works. It's a take-home message of this talk today. Mental health services work. For all of those individuals who experienced moderate to severe issues upon entering counseling, over 89% report that they have improved. They have been able to manage the issue that they sought help for, and they have recognized the transformative impact of getting mental health care. I'm often asked by veterans such as yourselves, what can I do to help someone? Identify, understand, and respond. Through identifying people in distress, we can reach them earlier before the worst outcomes happen. Important signs and symptoms include withdrawal and sadness, increasing irritability and anger, increasing use of substances, focusing on the negative, expressing feelings of being a burden, and talking about death or suicide. Respond by providing active listening. Ask questions about how they're feeling. Never be afraid to ask if that person is considering suicide. Share the stories of when you've had a time in need or of those who you have helped through their crises. Respond by connecting them to the resources in the community, through the Legion, through the VA, through the 988 crisis line or text services. And if they are suicidal, drive them to the emergency room. Never let them be alone. Thank you for your service and your sacrifice and being a partner of WellCare and letting me be a part of the 106th National Convention. With the annual enrollment period right around the corner, it's a great time to partner with WellCare so we can help educate veterans on their Medicare Advantage options while also working with your post to bring communities together. If your department or post hasn't yet connected with WellCare, please do so. I know there were booths out in the hall earlier that are coming down, but WellCare representatives will be here at the meeting. And remember always, you are the front line in caring for each other. That duty to serve each other never ends, even after deployment. We all are brothers and sisters in mental health and in the prevention of suicide. And I believe that with the work you have done and the contributions you have made to our country and our communities, you will always be brothers and sisters in preventing suicide and helping individuals receive the help that they need. Thank you so very much. Have a great conference.